The patient journey begins with the unfortunate initiation of an illness. Depending on severity of the illness, the patient can either reach an emergency department or their primary care physician. There they are examined, additional investigations done, and based on inference, a treatment is prescribed. In the emergency department, the treatment is preceded by triage, which is classifying severity of the illness, resuscitation, that is life-saving measures, and further goes on to subsequent treatment of underlying condition. If the illness requires a more concentrated and supervised care, then an admission is recommended, thus taking the medical care into an inpatient setting. If the illness can be treated without admission, then it is said to be an outpatient setting, or can be referred to another doctor known as referral for more specific treatment. Before start of the treatment, the basic details are obtained. Alternatively, when the patient is converted into an inpatient, based on the patient's treatment and progress, they can get transferred to other wards like intensive care unit, surgical wards, or specialty wards, where more focused treatment can be provided with appropriate infrastructure. All relevant information regarding the patient's medical condition, history, care, and outcomes are documented in a file called the patient's medical record. On providing treatment when the patient is deemed fit to go back home, a discharge is initiated. Follow-up visits can be recommended if necessary. The appropriate diagnosis or procedure codes such as ICD, CPT are recorded prior to generating the bill. Subsequently, the bill is presented to the person or entity identified as responsible for payment. Usually, the billing information is sent to insurance companies in the form of a claim, where the individual has a health plan. This process is now going through a phenomenal transformation with the influence of information technology, where the entire information is digitized at source through an electronic medical record, and then individual electronic records are linked to create an electronic health record, providing a composite picture of the patient's health through their lifetime. Emerging healthcare trends and needs are creating data everywhere, causing the healthcare organizations to deliver business values through the velocity of data. We at Accenture strongly believe that insight-driven health is the new foundation to drive effective, efficient, and affordable healthcare right from health back office all the way to the doctor's office. Our insight-driven health services includes Connected Health Liquid Hub, EMR Liquid Hub, and Healthcare Analytics Liquid Hubs that provide a range of services, offerings, and business values to help healthcare organizations deliver strong outcomes and enable a healthy nation or universe. In healthcare, consumerism is an orientation to new care delivery models that encourage and enable greater patient responsibility through the intelligent use of information technology. We at Accenture established digital delivery such as mobile apps, digital security, digital ennoblements for portals, etc. for various engagements improving significant patient care and client satisfaction. Health insurers provide reimbursements to care providers for the care administered for their members. A person can take a group health plan or individual health plan. Group plan is normally through the employer and has certain advantages like guaranteed coverage, lower premiums, and comprehensive care services. Whereas, in an individual plan, the benefits are tailored as per the risk rating of the person and premium payability. The plan usually includes a portion of the cost of doctor's visits, prescription medicine, hospital charges, ER visits, and more. 4 important features define the health plan. 1. Deductible. The amount you're responsible to pay for covered medical services before health insurance starts paying. 2. Copay. A small amount a plan member pays each time they visit a doctor. 3. Plan type. 2 main insurance plans are HMO, Health Maintenance Organization, and PPO, Preferred Provider Organization. In the HMO plan, the member chooses a primary care physician who helps coordinate the member's care. No coverage is provided for providers outside of the HMO network of physicians. In the PPO plan, no referral from a primary care physician is required to see a specialist and allows the flexibility to visit providers outside the network for a higher fee and a separate deductible. 4. Out-of-pocket limit. This is the maximum amount to be paid for medical services in a calendar year. Once this is reached, the plan begins to pay 100% of the allowed amount for covered services. Health insurers enter into negotiated reimbursement contracts with various hospital networks, doctors, and diagnostic labs as to what they will charge a patient for covered medical services. For those populations who are not covered by private insurance, there are two government-funded plans, Medicare and Medicaid. Medicare is intended for uncovered or undercovered elderly and disabled people. Medicaid is for poor and disabled. Another growing area of focus has been pharmacy benefit management, as it aims to rationalize the access and use of medicines so as to control costs as well as to improve patients' prescription healthcare benefits. It is an add-on insurance option where the member gets additional coverage for pharmacy medicines, which otherwise can be a significant burden on the patient, resulting in non-compliance of care advice. The entire health ecosystem is focused towards quality outcomes, sustainability, and cost reduction. This is to ensure that there is universal access to services and no one is left behind. Providers are leveraging care management protocols to improve patient care and reduce the need for medical services by helping patients and caregivers more effectively manage health conditions, thereby deriving quality outcomes at a minimal cost. Payers are focusing on getting maximum coverage so as to ensure every individual has the financial support for healthcare. This has also been driven by various governments through legislations like the Health Information Technology for Economic and Clinical Health Act, also known as High-Tech Act. Some key areas of development are as below. Stringing of various sources of medical information results in what we call as connected health, seamless communication across different systems, giving an end-to-end health picture of an individual requires integration of the involved systems with adequate data security protocols like Health Level 7. This smooth movement of data across systems is also called as interoperability. Connected health is not limited to institutional data, but also remote locations like home health, hospices, etc., with the intention to maximize healthcare resources and provide increased, flexible opportunities for consumers to engage with clinicians and better self-manage their care. At this point, it is easy to conceptualize the benefits on population health by having an electronic health record through connected health. As each individual generates a record, a world of information is assimilated that can be leveraged to enhance the health of the population through analytics, understanding trends, and predict possible interventions. It makes easy work of identifying and tracking epidemics, as witnessed in the recent Zika and Ebola outbreaks, by tracking sentinel indicators that will then trigger preventive interventions to restrict and end their spread. This gives the policymakers a unique insight into the overall health of the population, helping them make decisions that have maximum impact on the outcomes. A healthy population is sign of a nation's prosperity.